Good evening, everyone. I'm starting again, working again for you all, and coming up basically with all the case based learning sessions because now the CBME pattern has changed, and you're going to get one or two integrated or problem solving questions. ठीक है, so a normal question को we can just put it or frame it in the form of an case. So this is a history of a 24-year-old pregnant woman who is coming to the hospital with preterm labor. That means delivery is around 27 weeks. After the delivery, the baby cried but subsequently began to grunt and showed signs of hypoxia despite of oxygen supplementation. So this is very important. Hypoxia despite of oxygen supplementation. The baby immediately was intubated by endotracheal tube and was given surfactant. And as soon as the surfactant was given via the endotracheal tube, the baby's hypoxia resolved, transferred to the neonatal intensive care unit for further stabilization. Now, your first question could be, what is this clinical condition? Obviously, you know that here, which is related to a preterm delivery. Okay, so either the question could be preterm delivery, or it can also be in the form of a history given to a diabetic mother, because a diabetic mother is also prone to have a baby which will have deficiency of surfactant and will land up in the respiratory distress syndrome or hyaline membrane disease. So the diagnosis of this is hyaline membrane disease or the respiratory distress syndrome. Now, what physiological aspects can be asked to this when this type of a question comes to us? What is the role of surfactant in lung? What is the major site of airway resistance? How does stimulation of the parasympathetic system affect airway resistance? Or I can give you here also a note on compliance, because all these are interrelated. Surfactant is basically related to compliance. So instead of asking you simply about surfactant or about compliance, definitely a beautiful clinical case can be presented to you so that you are able to integrate it. So let's solve this. Definitely, this is a case of a premature infant who was born at 27 weeks of gestation, which required intubation and surfactant. See, it was not oxygen which resolved, it was surfactant which was given via the endotracheal tube. The baby is with hyaline membrane disease, that is respiratory distress syndrome. As far as surfactant is concerned, we know that it is a surface tension lowering substance. It is a surface tension lowering substance. It is produced by type 2 alveolar epithelial cells, which are also called as granular pneumocytes. Remember, there are two types of alveolar cells, type 1 and type 2. Type 1, which cover 95% of the surface area, which are flat, are associated with gaseous exchange, and type 2, which are producing surfactant, which cover maximum 5% of surface area, right? So surface area coverage is more by type 1, involved in gaseous exchange. The next question was the major site of airway resistance. Why the major size of airway resistance is medium sized airways, which comes around 16th generation as per as the Webel's model, which are also called as the terminal bronchioles, which are also called as the terminal bronchioles. The reason is that if you look into the histology, you will see that these terminal bronchioles, the medium-sized airways around 16th generation, have got maximum smooth muscles, and therefore they are very much susceptible to bronchoconstriction and bronchodilation, right? Remember, parasympathetics, that is cholinergic fibers, they cause bronchoconstriction and are associated with increase in the airway resistance, right? Another important point, there is a diurnal variation where the bronchoconstriction is maximum at 6 a.m. in the morning. So यहाँ पर there is maximum bronchoconstriction, whereas In the evening, that is towards 6 p.m., there is maximum bronchodilation. So the parasympathetics are bronchoconstrictors, the sympathetics are bronchodilators. And iske alawa, you must also remember that there is something which is called as non-cholinergic, non-adrenergic substance, that is VIP, vasoactive intestinal polypeptide, which is a very very important bronchodilator. And as we will come towards GIT, it is also responsible for increasing the blood flow in the GIT. There also it is acting as a vasodilator and a relaxant, right? So and what is compliance? The ability of any structure to stretch, distend, but come back to its original shape, like the elasticity of a rubber band. Remember, there are two types of compliance: static compliance, dynamic compliance. Then you might have also studied specific compliance. Then as far as LAQ is concerned, you must be able to write the conditions where there is increase in compliance, like aging, like emphysema, the conditions where there is decrease in compliance, for example, fibrosis or pulmonary edema, right, where the condition is not able, where any condition where the lungs are not able to expand. So restrictive type of disorders may there is a decrease in the compliance, whereas obstructive type of disorders may there is an increase in compliance. So let's try to summarize this concept with the help of MCQ. A pulmonary physiologist notes that the lung characteristics of individuals who lack surfactant and those with pulmonary fibrosis are similar. But which of the following occurs in patients who lack surfactant? Collapse of small alveoli and expansion of larger alveoli, increase in the lung compliance, increase in the total lung capacity, or decrease in the work of breathing. Right? Any guesses? Yes. So यहाँ पर remember best is option sorry, yes, those who lack surfactant, they have got increase in the work of breathing. So what they basically have is the collapse of small alveoli and expansion of the large alveoli, because surfactant is related to one of the very important property which is called as, if you take two balloons, this is a smaller one and this is a larger one, there is a tendency that the smaller balloon will collapse and its air will go into the larger balloon. Similarly, it can also occur with alveoli, right? But the very important property, that is the Laplace law, which is maintained by surfactant, the surfactant use this property of Laplace law, and they decrease the surface tension of the smaller alveoli and prevent the smaller alveoli to collapse or empty into the larger alveoli. So they are also taking a very important role in alveolar stabilization. Apart from decreasing the surface tension, decreasing the work of breathing, this important property is also called as alveolar stabilization. So with this, we come to the end of the this particular topic. And remember that one thing very important is self-discipline. You have to be very, very persistent in your studies. There are times where we study more, where we study less, doesn't matter. But daily, a small amount of dose will help you to get good results without stress. So thank you for now. Join and please suggest me what else we should discuss together. Bye bye.